This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations. The following video will cover these specific topics.
Hello. In this video, you are going to be hearing from 3 experts about telehealth best practices and diabetes. Our first speaker is Ann Wolf. Ann Wolf is the director at the Virginia Center for Diabetes Prevention and Education at the University of Virginia. She has been using telehealth and technology since 2008, applied to the clinical, research, and business settings. Thank you for joining us today, Ann.
Thanks, Rebecca.
Ann is going to address diabetes prevention and telehealth. Prediabetes is estimated to affect 30% of the patient population. So, Ann, how can a federally qualified health center or rural health clinic think about using telehealth and mHealth to address prediabetes?
So a really effective evidence-based program to address prediabetes is called the National Diabetes Prevention Lifestyle Change Program. This program is a year-long program. It is a group-based program. It meets 22 times throughout the year and has a lifestyle coach and has an approved curriculum to really assure effectiveness. Now, we can use technology to deliver this program and also for group engagement. And this provides greater access to our program, and it also provides greater flexibility for our staff members. And we know how important that is for our rural health centers. So one delivery modality of the National DPP is called distance learning, which is a live synchronous delivery using a secure video teleconferencing platform such as GoToMeeting or WebEx, or there are many secure platforms out there so that you can meet with the group at the same time. This program can also be delivered asynchronously using an online platform. Right now, there are 13 states that have purchased an online platform called HALT, which allows clinics in that state to use that online platform to deliver the program for a free or reduced rate. So that's going to be another option for many states. Now, your clinic may not want to deliver the program, but please think about referring to the program. You know, in the past, and if we did this in person, we would think of our referral network within an hour distance of our clinic. But using technology, we can expand our referral network out to 4 hours. 60% of the national DPPs now use distance learning to deliver the program. So you can refer to a program that's 4 hours away, but still keep that local culture and everything that's so important when you're having a group-based program. For engagement and helping people start to take control of their life, we can use mHealth. So mHealth can be used to engage patients in between visits, such as diabetes, which has a prediabetes aspect to it, which provides text messages and keeps everything alive for that person and that patient. We can also use mHealth for accountability, such as Lose It, which helps us to record food intake and activity and helps people engage in their own health. And then we can use mHealth to really address the individual needs of our patients, such as medication management or stress reduction. So there's so many mHealth apps out there that will help you.
Thank you, Ann. There are still areas, though, in our country that don't have great internet service. Is there an adaptation that federally qualified health centers or rural health clinics can use when there is no or little internet?
Absolutely, Rebecca, and thanks for bringing that up. Distance learning delivery also includes a telephone conferencing line. And in fact, the National Diabetes Prevention Program is based off of a research trial called the Diabetes Prevention Program. And that program used the telephone conferencing line to deliver their group classes in their follow-up years afterwards, because they found it was very easy and it was really effective. And we know the results of that trial really do indicate that the diabetes prevention program is an effective program. And they use as simple as using the phone. You don't really need the internet to deliver this program. You can get good group interaction using a phone conference line.
Thank you so much, Ann. We're now moving on to our second speaker, Viola Holmes, who will address diabetes education and telehealth. Viola is a registered dietitian and certified diabetes care and education specialist. Viola has been providing diabetes teleeducation since 2008. Additionally, Viola has been instrumental in the setup and delivery of telehealth diabetes self-management education and support visits at the University of Virginia Outpatient Diabetes Education Program. We appreciate you being here with us today, Viola.
Thank you, Rebecca.
How can a federally qualified health center or rural health clinic use telehealth to provide diabetes education to their patients?
Well, one option for clinics that have multiple sites is to identify a healthcare professional at one site that has specialized knowledge in diabetes, such as a registered dietitian or a nurse educator. This individual could serve as the telehealth diabetes educator and provide classes for all of the sites. So patients could come into this clinic that they receive care at and attend a diabetes teleeducation class remotely with all of the sites with that educator. And if the educator is a registered dietitian, there may be opportunity for the clinic to bill for group or individual medical nutrition therapy telehealth visits.
What about clinics that don't have a staff member with specialized training in diabetes or nutrition? How can they utilize telehealth for diabetes education?
I would suggest they reach out to nearby hospitals to see if they have a diabetes self-management and education program, which we refer to as DSMES. Most DSMES programs offer telehealth services now, so the clinic and the DSMES program could partner and have the educators from that program provide telehealth services for the clinic. This is an excellent option for patients to get the individualized diabetes education that they need by a certified diabetes care and education specialist remotely. So this is really a win-win for everyone, and especially the patient, because we know that when patients receive DSMES, it helps to improve A1C levels and in turn reduce some of the risk associated with poorly controlled diabetes.
Thank you for sharing your expertise, Viola.
Thank you.
Our last speaker today is Dr. Michael Cusick. Dr. Cusick will be talking about diabetes retinopathy screening and telehealth. Dr. Michael Cusick is a board-certified ophthalmologist who specializes in diseases of the retina. He is an assistant professor of ophthalmology at the University of Virginia, where he sees patients and works with the UVA eye care team to coordinate the diabetes retinopathy screening program. It's great to have you here with us today, Dr. Cusick.
Thanks, Rebecca.
We know that diabetes affects the whole body. Can you explain how diabetes affects the eyes?
Yes, and thank you again for giving me the opportunity to speak about this very important topic. So as we know, diabetes is a major public health concern. Approximately 34 million people in our country have diabetes, which comes to about 1 in 11 people. Of those who have diabetes, approximately 40% have diabetic retinopathy, and these numbers are expected to double by the year 2050. So it is the leading cause of blindness in our country in working age adults. Now, the eye is a very complex structure, but we like to think of it like a camera. The front part of the eye focuses light onto the back part of the eye. But diabetes, as you mentioned, can affect the entire eye. In the front part of the eye, diabetes can affect the cornea and cause dryness and redness to the eye, and patients may have burning or tearing. In the more central part of the eye, diabetes can lead towards cataract formation, which can also lead towards blurring of the vision. And finally, diabetes can affect all the small capillaries in the back part of the eye where the retina is, and this can lead towards bleeding and swelling and vision loss. Patients can get flashes or floaters and even go blind from diabetic eye disease. So it's very important that even though patients may have no symptoms, yet have diabetes, that they should have an eye exam.
So what is the difference between a telemedicine visit and an in-person eye exam, and a little bit more on why these screenings are so important?
Great question. Now, telemedicine is the use of technology to provide clinical health care at a distance, and it really helps eliminate some of the barriers which we see in healthcare and can really improve access to care. When we talk about screening, we're talking about examining asymptomatic individuals for signs of an eye disease. And in ophthalmology, a telemedicine screening for diabetic eye disease consists of taking a photograph of the back of the eye which is the part of the eye most commonly affected by diabetic eye disease. Now, these photos of the retina are then evaluated by eye care doctors, and this information is then sent back to the primary care office about the possible need for a referral for an in-person eye exam, where a more thorough exam can take place. At the in-person eye exam, that's where the entire eye is evaluated and more tests can be performed if necessary. Now, screening is so important now because we know that early intervention can save patients' vision. Unfortunately, less than 50% of people who have diabetes are undergoing the recommended screenings, and many patients who have no symptoms can still have eye disease. If patients wait until they have symptoms, sometimes the damage can be irreversible. By the time patients are screened, we know that approximately 20% of patients have retinopathy at their first eye exam. So there really has been a paradigm shift in diabetic retinopathy screening and in treatment, from treating patients at the more advanced stages to treating them earlier. We now have therapies that, when initiated earlier, can actually halt and reverse diabetic eye disease before major symptoms occur. So screening is much more important than ever. And here at UVA, we're really proud to be able to offer remote screening opportunities for patients.
What an exciting technology. Thank you so much for sharing that with us today. UVA's Telehealth Village has training modules on using telehealth to deliver the National Diabetes Prevention Program, diabetes self-management education and support, and for diabetes retinopathy screening. For those of you who want to learn more, please visit telehealthvillage.com to find out about this exciting and wonderful learning opportunity. Also on the Telehealth Village site, you can join the Innovation Exchange community to share and learn about different program models around the country using telehealth in their practice. Thank you to Ann Wolf, to Viola Holmes, and to Dr. Michael Cusick, and to the Telehealth Resource Centers for distribution of this video.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.